This video is presented by TRACS WA, Training Centre and Subacute Care. In this scenario, the multidisciplinary team at Brightwater Care Group are meeting to review the care of 50-year-old Nick, who's previously suffered a pontine hemorrhage. With a tracheostomy in situ, the plan today is to assess and review Nick's cough, voicing, swallowing, and his ability to tolerate cuff deflation.
Nick's a really good communicator. He does let us know yes or no using head nod and shake or a thumbs up. And if you've got any questions, Nick can use his alphabet board to spell out anything that he'd like to know. So feel free to do that, Nick, if you need to, okay?
When I checked this up this morning, everything was fine. His SAT was sitting between 96% and 98%. His respiratory rate was 14 beats per minute. NIM seems to be going very well with his decoughing.
Great. Any suctioning overnight?
No, I haven't had to suction him overnight.
Okay. And does he have a good cough?
Yes, he's got a very strong cough.
How is his stomach side? Is it nice and clean?
Yes, his stomach side is nice and clean, and there are no hypergranulation at all.
Good. All right. Stella, would you mind just listening to his chest for us?
That's fine. Are you happy with it, Nick?
Yeah. Okay.
Sorry, I have to go under the shirt.
Big breath.
He's got normal breath sounds, and there is good air entry in both basics.
So Stella's gonna take the Swedish nose off, and you're gonna give us a good cough, okay? But if you need suctioning, let us know. Let's try the cough first. I think that's the best way to go. Yeah, you prefer that?
Yeah. Fair enough, Nick.
Okay.
All right, Nick, I'll take this off. And you have a big cough for me, okay?
Okay. We might have to suction Nick.
Or maybe, can we clean the inner cannula first, perhaps, and see if that does the trick?
Yes, that sounds good to me. Are you happy with it, Nick? Good job.
We'll just have to clean the cannula. Big breath. And out. Yeah,
That sounds great.
sounds better. I think it was all stuck in the inner tube, so no suctioning required. Good.
Well done, Nick.
Okay. So I think we're all happy to go ahead with the decoughing. Okay, so Nick, we're gonna put the balloon down, but Eva's just gonna explain to you what we're gonna do.
So, Nick, we're just going to let the air out of the balloon around the tracheostomy tube inside your throat. So your breathing might feel a little bit different. It's just so we can see how you're going, breathing through your nose and your mouth. Okay? All right, well done.
I was just thinking we might have to untilt him a little bit. So you're sitting upright. Is that okay, Nick?
How you doing there, Nick? Are you okay? Yeah? There we go. So that's fully up.
Yeah. Comfy?
Are you able to hold your head up okay?
Looks really good.
Yeah? Brilliant.
Do you need this?
Yeah.
So
Yeah, that's a good idea. So Nick, I'm going to take the air out of the balloon around the cuff while Stella just gets ready to suction any secretions. Okay? Beautiful. Now, if possible, Nick, if we can just put your hand so that we can have a look at the SATS monitor in that way. Stella, can you see that okay from there?
Yes, thank you.
Okay, and I'm just going to take your Swedish nose off. All right, just give that to you, Menna, thank you. And we'll take the syringe now so that we can take some of the air now out of the balloon, and at the same time Stella's going to suction any secretions that might have fallen down. Okay? Okay, so the balloon is uncuffed.
Big cough.
Well done.
Well done, Nick. And take some deep breaths. Beautiful. Well done. That's good. How are the SATs looking?
Yep, they're looking good. 98.
It might be good to see, Nick, how you're going, just breathing through your nose and your mouth. So what that means is that Tanya's just going to put her finger gently over the end of your trachea tube, and it might feel a little bit different to you. It might tickle your throat and give you a bit of a cough, but we can stop at any time, okay?
I'll keep an eye on the SATs, they're good.
So Nick, I'll just use my finger here and I'm just going to put it over the end of your tube now, so it might feel different. Wow. Fantastic, boys. You're showing off now, aren't you? Good work.
Good to hear.
That's so good to hear your
How
voice
did that
then,
feel? Good? Excellent. Brilliant.
Could we maybe try doing it for a little bit longer this time? And Nick, that's awesome that we heard your voice. I'd just like to look and see just at your breathing this time. So just breathing, trying to breathe in through your nose and your mouth.
Okay, so don't worry about using your voice at all. So I'm going to put my finger over the tube again, and we just want you to breathe in and out through your nose, okay? There we go. So nice breath in.
Can you maybe count up to 5 for us, Nick? Tell us your first name. Okay, great. Well done. You're getting some excellent voice there, Nick. We've got a lot to work with. Tanya might just put her hand on your throat and just get you to swallow your saliva.
That's it. Just move your tongue around and see if you can get any saliva down.
Okay. Was that a swallow then, Tanya?
There wasn't a lot of elevation there.
Okay.
So
Is your mouth a
Nick's-
bit dry, I wonder? Nick?
Yeah. You feeling a bit dry? Yeah.
Maybe we could give your mouth a little clean, and that might just help to get those swallowing muscles working.
If you could just look towards me a little bit. Beautiful. I'm just going to run this around your mouth. Just moisten up your tongue. There we go. Around here. Fantastic. Okay. Thank you. Okay. If we just bring your head just slightly more forward, bring your chin down a little bit. That's it. And see if you can swallow for me now, Nick. That's it. Well done. Keep trying. Okay. That's it. Have a little rest. Relax.
It's a bit tricky to get those muscles going the first couple of times.
Yeah. And we got a swallow there.
Okay, well done.
Well done, Nick.
Good effort, Nick.
Well done. Have a little rest. You can pop your head back into the headrest. Just make yourself comfy.
Okay, so Nick, you've done really well with your assessment today. We've got some really useful information. We know that your secretions are fairly minimal, which is great. Your oxygen levels have been looking good. The swallowing was a bit tricky, but that's something that we can work on. And what we're going to do after this is meet back as a team, and we'll just talk about what's gone well and what kinds of things we might do next with your tracheostomy. Have you got any questions or feedback for us? No? Okay, great.
So well done. You've done such a good job today. Let's make you comfortable. So we'll put your chair back into some tilt now. Okay. So let's get you back down.
Okay, Stella, so what's the plan now?
We'll have to leave the cuff down for 5 hours, after which I have to come back and put it back up because he'll be going out with his mum at the time.
Okay, so the cuff goes back up when he goes out for a visit?
Definitely, yes.
Okay, sounds really good. Now, how would you guys normally document the decuffing time?
We've got a chart where we document everything we do with him in terms of the cuffing. On the chart, he's got a column for the OBS, he's got about his coughing, he's also got about the secretion. So what we do is we would also document about the time and just let everyone on the team be on the same page to know how many hours he's able to tolerate the process.
Okay, great. That's exactly what we do at the hospital. So, fantastic.
Well done,
Lovely
Nick.
to meet you, Nick. Well done today. We're going to head off now and have a chat about what happened today and come back with a plan, as Eva said. So, thank you so much. That was really lovely working with you today.
Yeah, it's great to meet you, Nick. Thanks a lot. We'll see you soon.
Yeah.
Okay.
See you later, Nick.
See you
See
later.
ya.
Thank you, guys.
You've done brilliantly well. Everyone seems to be very impressed with how far you've come through, and we're all happy and glad with what we've seen so far. So what I'll be doing with you is I'll have to put back the cuff, okay? I'll have to put some air in and put the cuff back up, all right? Because you'll be going out with mom, okay? and I'll check with the manometer to see if it's sitting within the right zone. How do you feel, Nick? I'm going well? Yep, cuff pressure is fine. Do you feel comfy this way? Can you show me what you want me to do for you? Yep, that's a T, I, L, okay, and T, tilt. How would you like me to tilt you, forward or backwards? Forward? All right. What will happen is Tanya and I will be here 9 a.m. tomorrow morning to set some goals with you. We want you to be fully involved in the process. Mom will be here shortly to take you out, so I'll leave you to it. You have a great day. Thank you.
TRACS WA would like to thank the staff and management of Brightwater Care Group for their involvement in this project. This project received funding from the Australian Government.